And to discuss this matter further and the report as well, we're now joined by the Commission for Gender Equality's Commissioner, Dr. Tlaleng Mofokeng, who's joining us in studio, and from our Seapoint studio in Cape Town, Sehaam Samaai, who is the Director of Women's Legal Centre, who's joining us from our Cape Town studio. Good evening, ladies, and welcome to The Full View. Dr. Tlaleng, let's start off here. How did we come to this particular report?
Well, the Commission for Gender Equality received a report around March in 2015, and in which we received affidavits of 48 women who alleged at the time that they had undergone forced or coerced sterilization while in the care of public health facilities. And we had 5 in Gauteng and 10 in KwaZulu-Natal. And basically the department had Her Rights Initiative as well as the International Coalition of Women Living with HIV as the main complainants. And then we had the Provincial Departments of Health, Gauteng and KwaZulu-Natal, as well as the National Department of Health as the complainants. And we have then come to this point now.
The department as a complainant?
As the respondent.
As the respondent, okay.
So the two national departments and the National Department of Health as the respondents in this matter.
And the reports that you got, were the reports just specifically on KZN and Gauteng, or did they also look at other provinces as well, but came to the conclusion that most of these cases are concentrated in these 2 provinces?
So how the Commission for Gender Equality works is that we can investigate of our own accord or when complaints are received. So for this particular investigation, we did have affidavits of those 48 women, and those are the hospitals that they covered. So we were not doing a prevalence study per se to find out where in the country this is happening. We focused our investigation on our site visits based solely on the complaints that we had received. Because remember, there's issues of consent and confidentiality. And in this very manner, we had to wait. And unfortunately, why the commission took long is because we had to follow up all the processes of consent, even from the complainants themselves.
So it is probable that this could have happened in other provinces as well?
Yeah, it's not something that we have to, have a far-reaching imagination. And I think one of the recommendations that the Commission has made is that, because today we made a finding that indeed women have been forced or coerced into sterilization. And one of our recommendations to remedy this is that the Department of Health has to embark on a wider study of prevalence in South Africa. And that will give us then the numbers we need to know in terms of incidence and how much of a problem this in the country. But in terms of anecdotal evidence, the CGE has enough to suggest that this practice is widespread across the country.
Sehaam, your take on this, and particularly these 48 patients who came forward and spoke, and the words being used in the report as well, that they were being coerced.
Yes. The clients came through, as Dr. Tlaleng have indicated, through HRI and Her Rights Initiative, as well as another international organization. And the Women's Legal Centre at that point in time was the attorneys who represented both organizations, and we thought that the CGE was the best a structure to be able to deal with the systemic challenges of forced sterilization. One of the issues that we've raised in our submission, or the complaint that was submitted, was that there was 4 different types of remedies, and the challenge was that most of these women didn't know after, before 3 years that they were forcibly sterilized. Many came out 11, 10, 5 years later and realized. And if you want to refer a matter to the Equality Court, or you want to bring an application against the department, you have to do that within 3 years. You can also lay a criminal charge in terms of the Sterilisation Act, but it was very important for us as well as the clients that the systemic challenge be addressed. So with regard to sterilization, I think it's clear that it's a form of medical procedure that permanently stops fertility, and it can be done through a hysterectomy that was done by the person that was speaking earlier, because where a whole uterus was taken, or it can be done through a tubal ligation. And the challenge that you're sitting with is that it's irreversible. And many of these women did not know what the procedure was about, even though there was consent documents that were signed in all of them. But it was important for our clients, which was HRI as well as ICW, that these women, or we had to push for informed consent. And what does that mean? And that is why we welcome the report of the CGE, because forced sterilisation is a human rights violation. It is actually a gross human rights violation in terms of international and regional human rights instruments. And in terms of our constitutions, these women's right to equality and dignity has been violated. And we need to be able to see how is it that we will be able to deal with this. And also one of the recommendations of the CGE was actually redress. And we're talking about redress beyond the prescription period of 3 years. And that was something
what does the
which was
redress
quite
entail?
Phenomenal, because
what does the redress entail?
2015, the department did not want to accept the issue of redress.
What does the redress entail?
Well, as you could hear, I mean, many of these women have indicated that it's irreversible. They did not know, their families did not know. They found out that they could not have children after 10 years. What the report also found was that many of them was between the ages of 20 and 40, which means that they could still have given birth to children.
Sure.
And what does that look like? How do you compensate those women? And how do you ensure that there's redress and justice for them? It's what the CGE did was to also take into the recommendations of HRI and ICW in the complaint, which was to refer the complaint to the different institutions, which is the nursing institution, to be able to look at all of this, including Department of Health, and also to look at the legislation, where they are making recommendations to the South African Law Reform Commission. But that is dealing with it on a systemic level. What about the women? And we are talking about 48 women. That have been forcibly sterilized, and it's a finding from the CGE. And I do think that the Department of Health need to look at this and see how is it that they will be able to redress and assist those women.
Dr. Tlaleng, from the CGE side, what sort of redress is possible? In one of the interviews that Griselda did, the lady speaks of no money would bring back my uterus.
And justice, you know, it's a very personal thing. And you can't put a timeline to justice. You know, a lot of the problems that came through with this investigation is that, in fact, as much as the law prescribes 3 years, many of them only found out after 10 years of trying to have children that, in fact, they can't have children, right? And therefore started the journey of finding out why.
I see some were even depressed during that time.
So the United Nations Special Rapporteur actually defines forced and coerced sterilization as torture and inhumane and cruelty. And when you listen to these women, and as much as they were breaking down today during our presentation of the report, a lot of them live with socioeconomic consequences of this, being outcast from the families, marriages that have broken down. We know the issues of culture and lobola being revoked, right, because women cannot prove their fertility, and the mental health trauma and torture that these women have to go through. You know, a lot of them will measure how long this violation has happened by how old their last child is. You'll hear a lot of them saying, my child is now 13-year-old. It's been 13 years me living with this. Is
it possible, though, to quantify what amount would settle?
Look, it is quantifiable, right? But what that would require is commitment on the Department of Health to firstly accept that they have done a mistake, that violations of women have been gross and negligent. You cannot hide away from that fact, which has been missing. No one has actually said, you know what, something really horrible happened and we are sorry.
As the respondents, did the Department of Health accept culpability at all?
Not as yet. We've had different hospital visits where different provinces did come out. They've had some legal representation in terms of the attorneys at the National Department of Health present at some point of the investigation. But even today, the two members who were there was a legal representative and a lower ranking staff who neither had a mandate to either respond or represent the department formally in today's proceedings. And another thing is that in our recommendations, we did say that the Department of Health has to initiate a process of dialogue, with the victims to get to that part where what is justice. We can't make a blanket statement to what justice is. And a lot of these women, selflessly so, have really given of their time, of their life, and dedicated everything they have to ensure this doesn't happen to other women. And our concern as the Commission is that this is a practice that unfortunately seems to still be carrying on despite everything that we know about informed consent in the health field.
Sehaam, just quickly in conclusion, considering that the CGE found that in some hospitals they couldn't find the files of some of these patients, how then do you prove that indeed this patient was here and this patient was sterilized?
Well, I mean, legally, I mean, there is obviously the client then has information.
Yeah.
All of these clients made statements, and they also produced evidence that they were there, which means that from the department side, which is also a very good finding from the CGE, that they need to ensure that their filing systems is appropriate, it's efficient, because was not just the CGE that had a challenge with trying to find the information. Clients, and we know that there's always inequality of arms. I mean, how do you have a poor person coming from rural KZN with their own particular socioeconomic circumstances to be able to access their documentation when the CGE couldn't even access it? So I believe that is a very good recommendation, and the department should really look into what they are going to do to be able to ensure that there's proper record keeping. In addition to that, for many of these women to be able to go to the courts, there is it that you need, for example, the evidence and factual evidence. But at the end of the day, we need to be able to look at what does justice really mean for these women. And we need to be able to deal with the redress in a very particular way. It can be damages, or it can be some other symbolic manner or way to be able to ensure that whatever these 48 women have gone through, that it will not happen in this country again. And that there should be a broader form of redress, and we should not be confined just by the issue of damages.
And chances are that there are many, many more who haven't come forward with their particular cases. But you also want the Health Professions Council to also start to take action. And my question is, from the investigation that you've done, were you able to speak to any of the medical practitioners?
So the investigation was not about individual nurses or doctors. What made this particularly difficult is when you have records missing, which is in itself a gross violation, by the way, because keeping patient records, which are confidential with private medical information, is something that the state has responsibility for. So the fact that I was harmed within a public health system can't be my fault, and can't the burden be on me to prove when you are negligent and didn't keep my file. So it starts from there. But secondly is that this has to be a bigger public health system issue. If you focus on individual nurses, on doctors, it's very easy for people to be moved around. The first step, by the way, of ensuring that there's no accountability is to make sure that files go missing, because you can't go after an individual.
Suggestion has been, why don't we have an electronic filing system where patients can access their files from wherever they are, including medical practitioners as well. But thank you so much for your time, Commissioner Dr. Tlaleng Mofokeng, as well as Sehaam Samaai, who is the director of Women's Legal Centre. Tepiso, over to you.